Hello, everybody. My name is Alfonso Jimenez, and I am going to be the moderator today in a really interesting panel focusing in our health pillar of our EuropeActive manifesto. I will briefly give you an update of where we are regarding our second round of SafeACTive study, but we will devote most of our time today to discuss about the effects of mental health on well-being. I would like to initially acknowledge and thanks very especially to our sponsors that has been supported by our President's Council for Suppliers, Digital and Tech. Thanks to these companies to support our activity in this particular area. And I have today with me two really interesting presenters. Vojko Vukovic from 4P Fitness, 15 years experience leading and managing outstanding facilities in his home country in Slovenia, and at the same time now completing a really interesting PhD focusing the role of our industry in mental health. And we have as well our key speaker that will be presenting at the health panel at the European Health and Fitness Forum in November in Cologne, Dr. Imran Rashid, that is a public speaker, best-selling author that has been really interested in the role that human beings could play in the communities and how this will influence and will positively influence health. For us, it's a fantastic lineup of speakers today, and we hope to have a really interesting session. But before we move into this initial part of the session, I would like to briefly share with you an update on where we are regarding our SafeACTive study. Okay. If you remember, I think that you can see my screen right now. Yes. If you remember, we published last December our first independent assessment of COVID-19 cases reported in fitness clubs and leisure centers across Europe. We assessed 115 million visits during the second part of 2020 and compare this with the positive cases reported. The ratio was really low. What we identified is that along 2021, different countries have been facing different levels of lockdown of our industry facilities. So we are starting to collect data from the 1st of January, and we are asking operators across Europe to provide specific data about visits versus positive reported cases since the day in which they reopen facilities. This study is now developed using a better platform than we used in the previous one, online surveys, especially focused for research activities. We secure again ethics approval from our ethics committee at King Juan Carlos University, our academic partner. And what is interesting in this second row, that we have already collected more than 47 million visits with a really similar, really low ratio of positive cases per 100,000 visits, just 1.12, is that we are going to integrate this information, not just with the epidemiological data, but as well with the vaccination status per country per week, on the idea that we will be, again, reinforcing the message that our industry is delivering a critical social and high value impact role during the pandemic, both to reduce the amount of people affected, but the level of affectation in those who contract the COVID-19. And as we will discuss today, improving significantly the mental health of everybody. So this is the brief update from SafeACTive, and now let's go back to our session and focus our discussion in what are the specific elements that in our practice and professional practice, members will benefit from a mental health point of view. You remember that one of the critical elements that this pandemic and the special aggressive initial lockdown brought into the table was that people really need to move to feel well. This particular perception of well-being is very related with the behavior of the individuals, and individuals with active behaviors benefit more from this particular mental health protection. What we would like to discuss today are two key things. First one with Boyko, to discuss why exercise is so good in improving mental health, which are the evidence, what are the bases and the fundamentals. And the second one, really important, with Dr. Rashid, is what is the challenge and opportunity for our industry to really engage more, further, bigger and better with the members and the public to reinforce this positive role in mental health, and which particular attitudes, abilities, or capabilities we will need to develop to be able to address this challenge. So with you, Boyko Vukovic, addressing why exercise is good to improve your mental health. Boyko, the floor is yours. Thanks.
Professor Jimenez, thank you very much for the words. So I want to greet you from sunny Ljubljana, Slovenia. I will talk about how and why is physical activity and exercise beneficial regarding mental health. So we know that physical activity is beneficial in many different health aspects, and one of them is also preventing mood disorders and mental health. So in the last years, because of COVID-19 lockdown, many people haven't been able to exercise, or they haven't even walked to their job or drove a bicycle to their job, and they haven't doing any physical activity also on their work, and that had impact on, as I said before, different aspects of health. In Slovenia, we had some really interesting studies done by my colleagues on Faculty of Sports about how this influenced how the situation influenced motor skills, mostly on adolescents and children, because we have an interesting system of measuring motor skills and body mass index and every year for last decades. And in the time of lockdown, because of coronavirus, approximately sitting time of people younger than 18 years, it means mostly adolescents and children, were 7 hours, 9 minutes and 51 seconds. And the results of measurements of obesity, so the results of measurements after lockdown and before lockdown was that the obesity rate was raised 34%. It means 34% more obese kids after 1 year after than before the lockdown because of coronavirus. Also, the motor skills are 31% worse, and it means that it will be the economic influence of this situation will be at least $500 million per year. But I will talk mostly about non-activity influence on mental health, and already lots of researchers before the COVID-19 showed us that when controlling all the factors like gender, age, or socioeconomic class, education, body mass index, one of the most important predictors for the presence of depressive symptoms is the absence of regular physical activity. People who are not physically active are 1.4 times more likely to exhibit symptoms of depression. So what we did, we took the participants of the fitness centers, so the people who went to fitness centers before the coronavirus, and we gave them questionnaires, surveys when they came back after the lockdown. And so it was all people who were regularly active before the virus, the lockdown. And we asked them, of course, some demographic questions. Then we asked them, we gave them global physical activity questionnaire about their physical activity before the lockdown and in the lockdown. And we combined it with depression and anxiety scales from personality assessment inventory. And then we I will present you some findings today. The participants were on average 33 years old. We had 76 of them were male, 74 were female, and there have been lots of interesting differences between the gender. So the female participants who haven't been exercising or haven't done any physical activity had a lot more anxiety and depression than male participants, mostly affective, cognitive, and psychological anxiety and cognitive and psychological depression. So it's the similar findings have also done many other authors. So what is interesting for our study that I haven't found in other studies is the difference between previous competitively active and competitively non-active participants. Because one of the questions were, did those members of fitness center, have they ever in their life been competitively involved in some sports? It doesn't matter which sports, it only means have they been competing in these sports. And the person, all the participants who have been involved and have been competing once in their life for some time in their life, our results show that they are significantly more immune to mood disorders like anxiety and depression. We don't know why. Maybe Dr. Rashid will tell us more why, or somebody else, maybe Professor Alfonso, but maybe it's only because they're more fit, or maybe it's because they're used to anxiety before the match, or they're used to like if they lose, they're used to losing, the match, and so it's very interesting finding. Then we also found out that, similar as the other findings, that in the lockdown because of coronavirus, the single participants were a lot more likely to have depression symptoms than the ones in a relationship. So the singles are a lot more endangered. Then if we check the employment status, if you have the customers who didn't have jobs or students are also likely more to have anxiety and depression symptoms because of not exercising. It's some studies show the students in the first place. Some studies show the unemployment, the guys who are unemployed. But we had the unemployment participants were the most endangered. The students had the highest increase in sedentary behavior. So it means that they set the most, the increase in sedentary behavior was the biggest one. And in self-employed participants, we saw the greatest decrease in time spent walking or cycling to work, because most of the people who were self-employed didn't went to their offices, they stayed at home. That's pretty why. So the next thing we try to see is how education influences the changes in mood disorders regarding physical activity. And almost all the research show the same. It means that I want to say that the people who have better education are more or are less likely to experience symptoms of depression, anxiety, and the people with lower education will much sooner show those symptoms in the time of lockdown and not having enough physical activity. For females, especially, we saw a connection between sedentary time, increase in sedentary time, and depression symptoms. And in male participants, we also saw the connection between also sedentary time, but also less work-related activity and less walking and cycling to work, and anxiety and affective depression symptoms. So lots of males haven't been going to work, and that's also why they had less physical activity and more symptoms. So many other studies have proven the same. Also in Europe, from France, Switzerland, Many studies have shown that increase of sedentary time during COVID-19 lockdown was associated with lower mental health. It means that when our customers come back in our gyms, or now when they're here, we need to know that the role of personal trainers is not only to get the people look good and like aesthetics. You know, it's more that personal trainers need to take more holistic approach, because mental health is important and physical activity promotes mental health. And the personal trainer should be aware of that, and they should also be aware of social determinants of health and how they can influence with physical activity health, also mental health. You know, because, for instance, there in November I will present some more studies about this issue. But for instance, the physical activity that is a leisure time is a lot more beneficial for mental health. So it means that than the non-leisure time physical activity. For instance, if the customer is having a good time and the trainer is communicating with the customer, it's also a lot better for mental health and for health overall. So, if you have any questions, I would be like you to answer.
I think that thank you, Voiko. I think that you pointed out a number of critical factors, no? That probably we will later address deeply or deeper, no? But I think that it's clear that we, having faced this massive unexpected external factor transforming our life, the lockdown, people had to cope with something extremely aggressive regarding daily behavior. Okay, this automatically, of course, brought into the table these critical social determinants of health that relate to the active living behavior, but to any other condition as well, which is what is your education level, what is your previous experience, what is your regular daily behavior, you know, this critical gender gap between men and women regarding especially leisure time activities, including physical activity.
Yes.
So what is clear that is the pandemic as well brought again a key factor to acknowledge, which is that we have to address a number of health inequalities. Those who are in the lower level of our social development
are the most endangered.
As an industry, and I am always extremely critical with this, if our proposal as an industry is based on service that are from our public health point of view totally unsustainable, PT is one individual, one expert or exercise professional, is going to be really challenging for us to make our industry playing a significant public health role, okay? Because we need to connect and engage with many, and we have to do this at really affordable cost so we can address health inequalities. And it doesn't matter if it's going to be paid by the NHS, it's going to be paid by government, by a grant, and a sponsor or whatever, okay? So I think that we would like to later go into this role on this, but it's clear that the behavior of the individual was dramatically impacted by the pandemic. Dr. Rashid, let's move into how we could do as an industry to articulate a different proposal to get an opportunity to challenge these facts.
Yeah, thank you very much, and also thank you very much for the presentation or the small the facts that you emphasized here, Voiko. It's very important that we know that we have some common ground to stand on, that physical exercise is good. The sedentary time is equal to unhealthy lifestyle, etc. I mean, these things are important to know when you want to transform a fitness industry, which can be, you know, marketing and everything else. Underlying the basic core value proposition of the fitness industry is hardcore science that being active help people live better lives. That's like the starting point. what I want to look at is maybe a little bit a different angle. And while we sat here, I actually thought it would be good to share a small presentation. I can still actually do that, because if you see here, this is actually both the problem and the solution. We have a brain, and I hope you can see that on the screen, right? But the brain doesn't work as we think it does, because one part of our brain has the willpower, the reasoning, because that's what we talked about. We know what's good to do. We know it's good to be active. Then why don't we? I mean, what is it that holds us back? That's the important part to address and to understand if you want to make fitness industry or active lifestyle a part of the choices we make. Because what's important to understand is that there are also parts of our life which is caused by emotions, and that's the behavior we express, which are called habits. Habits are not chosen, they're connected to emotions. So if I want to feel something, I do something. That's why New Year's resolutions, which can be a good idea, they don't last, because it starts not feeling well in the middle of January or February, and then you just lose the brain power you need to. Finally, we have reaction and impulses, and these parts of our brain are important to understand, because what we think human beings are Homo sapiens, the wise man, or the one who are theoretically clever, but the problem arises because we don't understand what's going on beneath the sea. And that's the part which I call Homo habitus, which is the habitual man, or the part that is driven by emotions and habits. And that's why it's important to understand, when you build centers or give services to human beings, don't address the intentions. You have to address the actual behavior. What makes people come back? It's not choices, because the moment they get too stressed, they will probably stop going to, because they can't make choices. That's why you have to create an industry which focuses on the emotions that you create in human beings, because it's emotions driving the habits. And based on this brain understanding, we have to look at what the corona crisis actually did to us, because we have definitions of crises, which are new life situation that changes all the rituals, the habits, the way of thinking. And most importantly, it's about understanding what's going on and learning how to mentally master what's going on. So it's both, again, a matter of knowledge. We know it's important to be active, but if we don't have the mentally mastering, then we won't succeed in changing our reactions. And this is why when we create services addressing mental well-being, there needs to be both what you can call the active effort, which is what you do for people, and the reactive effort, which is what happens inside people. And the structural part of this is what you can make how you create the centers, that you have an inclusive environment, that it's clear what people should do, etc. But what happens is that people start going into the centers, and the questions you should ask as the fitness industry is, how does it feel to be a part of the center? Who am I doing something with? Where is the sense of belonging? Instead of creating these individual strategies like, my fitness pal, or my body weight, or my, don't make it individual, because what people actually need are being a part of a group, being part of something social. So in my opinion, the fitness industry, if you want to succeed in the future, create inclusive environments that makes people a part of something that's bigger than themselves, and move away from the superficial understanding of what health is, like weight loss or bigger muscles, because that's, sorry to say, that's so last year. We need to move on to a place where you actually go to the fitness centers, not to get bigger muscles, but to get blue brains. This is a study carried out by Microsoft, where they looked at how people's brain waves changed when they sat, for instance, at workplaces and had meetings without any breaks. then you develop what you can call yellow brain patterns, which are like the stressful ones. Down here, you can see that just taking short breaks between meetings, then you still stay on the less stressed level. And this is what mental health is about. It's not about choosing wisely. It's about making room for your brain to stay natural, because the way we live today is unnatural. And that's where I think that if you look at it that way and look at the reactive part, well, then human beings, the reactive part of human beings, should be considered as like we treat plants. We should fertilize, we should water, and we should shine on with meaning and purposes. And this is something that can happen in the fitness industry. You can make sure that people are healthy, that they meet other people, that they feel stuff at the fitness centers, like training together with other people, and they do something that is bigger for themselves, which is not about losing weight, but like maybe, I don't know, training and bicycling to support refugee camps in, I don't know, some place where they need this. So this is some of the things you need to deal with, in my opinion, to elaborate on. And this is actually backed by hardcore science, because in Denmark, we have a foundation which is called the ABC for Mental Health, who have researched intensively in not what makes people healthy, but what prevents diseases, which is like, how do you stay healthy without, I mean, normally the healthcare sector is go to the hospital when you feel ill, but we don't think about how to make people stay healthy. And that's where I think they have the ABC movement here in Denmark. They have coined it very well into 3 simple things. First of all, do things like act, to be active, belong to something, and commit to something. These ABC movements are something that I translate into these things. Do something where you forget yourself, because then you don't have the yellow brains. Do something that you're in full control of. And finally, you have to do something that affects you positively. This is the way you can start acting and engaging in activities that affects your mental health in a positive manner, which is, for me, something that could easily be accomplished by the fitness industry. So just to, like, you know, narrow it down or summarize what I'm talking about, I think we should move from the individual view on health that we've been doing for many years to a more community-based view of health, because then it's not you who have to choose to go out and become healthy. It's something that you do together with other people, and because the social part, the body, you know, if you have a training buddy, that will help, obviously. But if you are a part of a community and you really enforce those structural changes and the structure, you provide the community based environment at the fitness center, that's something that'll help you sustain people becoming more loyal to the centers. And also, yeah, the inclusive atmosphere, something which is something you can feel, basically. What are the emotions you want people to experience when they visit your centers? That's what you want to ask, because fitness can't be a product, but it should be based on emotions.
Okay.
And having said that, I would say, well, if you do that and you succeed in doing that, then I will welcome you in the healthcare industry instead of being in the fitness industry.
Okay.
Thank you.
Thank you, Dr. Rashid. I think that, you know, a number of key interesting issues for us to discuss now. No? If we move from a traditional perception of our industry, no? We were an entertainment industry, mainly interested or focusing those who were already active, you know, and those who were already active usually had this particular psychological capabilities that Boyko was referring previously, probably because they have a past competitor experience. They develop some psychological skills that help them to cope with the challenge of keeping exercise as an habit, that is about effort and regular effort, etc. But you brought the other elements, linked to this emotional and reactive effort, what you define as the Homo habitus compared to the Homo sapiens.
Yeah.
We did a really interesting study in my group a couple of years ago when we assessed all this Eurobarometer data. We have a number of papers published addressing physical inactivity, sedentary behavior in adults, adolescents, line analysis, etc. We identified that individuals that perceive that the area in which they were living have more opportunities to be active trend to be more active.
Yeah.
And at the same time, individuals who were reporting more reasons to be active, a summatory, more reasons, they trying to be more active.
Yes. There are also some.
And excuse me, Boyko, perceptions and this element of motives or rationals are connected with these emotions.
They are.
How do you think that we could activate this emotional side of the practice? And after we go to you, Boyko, as well. Okay, but Rashid, how we could activate this emotional reaction?
Sorry. Yeah. So the short answer, which I will elaborate on in Cologne, of course, in November, the short answer is make your centers focus on the customers instead of making the customers be something. I mean, create systems that matches humans instead of humans that you want to fit into your industry, and stop looking at the customers as consumers or someone who you want to do this or that, and start looking at them as completely normal human being. Understand what they're coming with. Maybe they are coming to get a little bit sense of control in their lives, which they don't have anything anywhere else. I mean, the life we are living today is externally steered. It's your boss, it's the social media, it's the business, consumerism, etc. So you don't have the sense of control. You don't have the sense of belonging. You don't have the sense of being someone who's active. And you don't forget yourself because you're constantly living with your brain. You need to start living with your senses as well. I think if you start focusing on those kind of experiences, you will not have to sell emotions. You will be the place where they come to feel emotions. I mean, that's where we need to understand. It's not a rational approach. It's an approach to create the sense economy, so to say. You have to focus on the senses instead of on the cost benefits about if you go here, you can lose those many kilos, etc. Sorry, Boyko, you had something on your mind as well.
Sorry, I totally agree with both of you. And when we're talking about motives or we're talking about motivation, yes, we were just doing also an article about motivation, and there are many different types of motivation. Some of the authors divide them in intrinsic and extrinsic, so outside and inside motives. And most of the motives, more and more often, are motives connected with some social acceptance, and motives that come from outside, also from social media. And those motives are being more and more important for people. We're using, I think, the Dr. Markland David from University of Wales, they developed the exercise motivation inventory too. We translated to our language, and we're doing research about it now. So in November, I will be able to tell you the results for our country. But it's really interesting when you look the studies in last decade about the motives. Also, the motives of people are changing. Also, more and more people are aware of health issues and how the exercise is good in preventing some health issues. So also the prevention is more and more important.
But I fully agree that we have a really good understanding of intrinsic and extrinsic motivational factors, and we also know what people we can define people's understanding and perceptions of how they think and believe into different knowledge-based approaches. What I suggest here is actually the opposite, because human beings, in my opinion, are you can perceive us as two different ways. Either we are intelligent, rational human beings who now and then fails, or we are erratic, emotionally driven, habitual driven creatures who now and then succeeds. And in many ways, I think that's the right way to deal with human beings. Don't talk to the choices, talk to the habits and talk to the emotions, because you can ask people, what made you come here? They will guess, because the moment they lacks, you can base your industry, the services you provide on things that people say, because the moment they don't feel, or they're too tired, or they have yellow brains, they won't make the right choices. That's why we can rely the world on rational human beings. I mean, that's one of the things I think we should make it easier for people to do what feels right. And that's why I think we should be more inclusive in the way we deal with these preventive healthcare measures, and open up. So, because it's very important what you addressed before, Vojko, this thing about that we only maybe in the fitness industry attract people who already have built their impulse control, who already have experience with being someone who can go from A to B because they know from themselves that they've done this before, and now they just need a place to come and just, you know, compete. But what we want to accomplish, actually, you should bring down the entry barrier to common people who just need to be a part of a social community. And that requires different doors, different things like, you know, yoga classes, or things like meditation, those kind of things. So that's where I think that the fitness industry should go from just being, you know, physical fitness to a lot more mental fitness, because that's the biggest problem in the world today is, of course, obesity, but more than that, it's mental illness, depression, etc. That's where we should move.
I agree with you. Also, our research that has been research I've been speaking about today, and the research we're just doing has been made in fitness centers. It means that also the yoga classes, Zumba classes, boot camps are included. So it's more holistic approach.
Guys, there are two key issues that I would like to discuss with you as well. No, we run here. I am leading a research lab in the biggest leisure clubs operator in Spain and Portugal, GoFit. No, we have about 250,000 of members, 260,000. You know, and the mantra of the company is around happiness. So the definition is, we are not a gyms company, we are a happiness company. Happiness is trainable as well. La felicidad también se entrena. When you get into a GoFit club, you will see this element of happiness. People automatically smile because of the happiness, and you know, and there is an interaction trying to promote this positive mood state, no, in which we create you know, is what we call our wellness hubs. No, we create ecosystems where the individual will rediscover the natural pleasure of movement, interacting, etc. So, for example, in our clubs, kids are coming for free up to 16 years old. So it's fantastic. So as soon as you get a free access to the kids, the whole family will come. We are addressing the gender gap. No, so we have more women as members than men in our clubs across Spain and Portugal, when there is a significant 22% gap in practice in Spain and Portugal against men and women, you know. So that is linking to this element of the structural decisions. So there are elements of how you build the experience, as Rashid addressed initially, but the other thing is these structural elements, no? How we could play with these structural elements.
Yeah, well, it's a very good question, and also a very good way you're describing this. When you say what you're saying, I come to think of how we talk about feelings, because feelings are not something you create. You can't create feelings. What you can do is that you can create the preconditions for feelings. And that's, in my opinion, something we forget. Often. We want people to be happy. No, don't make people be happy. Makes the preconditions, make them experience something that creates happiness. You can't create feelings. You can create the preconditions for feelings. And that's where I think many people today, they think it's an active thing. That's where my reactive part comes in, or the reactive approach. Think of your fitness centers, if you want to create emotions, as the approach. Think of them as, you know, what do you call it? The place where you grow plants, the glass.
Herbarium? Or...
No, yeah, not the aquarium, but the, you know,
herbarium.
Herbarium, yeah, with the tomato plants, etc. Why do you do that? It's because you want to have a certain environment where the growth is more, is better. The growth conditions are better than outside the herbarium. Right. So that's why you need to understand what are the preconditions for designing the fitness centers, the structure. If you want to create happiness, go ahead. What makes people happy? That's different. The different parts, they are happy of different reasons. Right. So that's why I think it's important to understand what you say, that that emotions are not created. They are
preconditioned.
They're preconditioned, yeah. And that's and one thing is also that we have some understanding of feelings, right? Normally, when I have lectures, I ask people in the next 20 seconds, try to guess as just name or remember as many emotions as possible. Normally people, they can only like remember 5 or 6 emotions, because it's not something you should remember. It's something you should feel. And how does this is an emotional, this is the human, like the piano of human beings. This is emotion. These are emotions. So what I want the fitness industry or anyone else who wants to create emotions to understand which emotions and which preconditions. And how do you create a ritual and just go and find out how do people, and the problem here is that you can't ask people what they feel, because then they will choose. Feelings are not choices, they're lived, they are felt. And telling what you feel is not the same as feeling what you feel, which is why it's the reactive part. And this is difficult. This is so difficult. I mean, if I knew how to make people feel exactly what I want them to, I would be Facebook.
Yeah.
Can I have?
Oh, so Boyko, excuse me.
So also the science agrees with Dr. Rashid. There have been some. So when we are talking about emotions, and there are many ways to prepare the place or the hour with the training with trainer. For instance, some articles have been done about the colors and in connection with depression, anxiety, and it can be shown that if a exercise is done in a green or blue area, it can be outside or in a gym with some like some colors like green or blue. They're less likely to be some mood disorder symptoms. So I can send you those articles.
Oh, that sounds cool. Does any article also say that if you meet people who are dressed in pink and have pink light in the back, do you feel happier?
I'm sure you do. I'm sure you do. I have some practical evidence, but not scientific evidence.
No, but this is interesting as well, guys, because I don't know if you know the work of Paddy Ekekakis, a professor of sports psychology at Iowa University, no? That is exploring really deeply this element of the affective response to exercise, okay? The affective response. The affective response is the emotional response, you know? Probably there are some caveats or elements that are not on this particular field are not able to understand. But this affective response is not just what is your VO2 physiological response, but it's what is the emotional, the affective one. Individuals that are connecting with the practice with a regular positive affective response, trying to stay in the behavior for longer, or to transform this behavior into the habits, no? So moving this from the into the habits.
And to build upon that, it's completely true. But what you have to do is to look at the effective response from the moment you enter the center, you sit in the front lounge room, you meet the receptionist, you small talk with the team members before you go to the Zumba class or yoga class, because everything is a part of an emotional impact.
Yeah.
So you have to create some kind of emotional journey for the customer. Yeah, and if you don't succeed, and the most important part of that emotional journey is the moment the last emotion you get when you go from the place, because that's what you remember.
Yeah.
What's it? So
contact person.
Exactly.
The last person that you saw.
It's the high five.
Yeah. Thomas Plummer, I think he wrote about it.
Yeah.
You know him.
Just the end with a high, and people will feel happy.
Yeah. Oye, trying to wrap up and trying to get into some take-home key messages. First, for the people to join us in November in our formal programs at the European Health and Fitness Forum and at the International Standards Meeting, we will be addressing this mental health capability, challenge, and opportunity for the industry. But as a summary, a snapshot, what you could tell to our audience today about the 3 or 4 key things that you have to consider to, improve mental health capability in our industry.
Should I go first?
Yeah, for example, go ahead.
Okay, thanks. Yeah, so first of all, what I would start to focus on is completely changing the way you understand your customers. Stop looking at them as customers and start focusing as them as complete normal human beings. And human beings are not what we think they are. They are, of course, rational human beings, but most of the time we're emotionally driven, habit driven, erratic, etc. And those are the humans we need to help, because, I mean, as Voiko has told us before, we have science. We know what's good. We know what they should do. Everyone knows that it's good to eat healthy, to be active, and all those things. But still, people don't. Why don't they? It's because living healthily shouldn't be about choices. It should be about preconditions that help us do what feels good together with other human beings. If you base your products or services or basically your preventive healthcare measures, which you should consider yourself as, if you base those on sense of belonging, and if you base it on non-competitive, more inclusive activities, then you will address human beings who don't show up because they themselves want to be healthy. They will show up again and again because they won't feel healthy if they don't are a part of your community. Those are the things I want to encompass. And at the Cologne conference, I'll be giving you the recipe how to accomplish that.
Oh, fantastic. Voiko, your take-home key messages, please.
Okay. My key message is that mental health is important and physical activity promotes mental health, and I'll be speaking about scientific evidence of that and how to and which kinds of physical activity and how to have the best impact on customers' mental health. And it also, of course, we can also include it in how to also in sales, in client retention, in client repurchase intention, and also in, of course, if the client is more happy, has as Dr. Rashid told us already, better emotional connection with our center, with our trainers, they will stay longer, they will be healthier, and it's better for everybody.
Yeah. Okay, guys, thank you. From my side, I would like to reinforce two key things. No? One is this critical challenge for us to effectively create the conditions for these positive emotions to happen, okay? From a structural, people, staffing, etc., whatever you consider. Second one, to design accordingly this emotional journey. So it's considering the experience and the opportunities to create these positive emotions along the journey. And the other critical one is that we have to consider that communities will play a significant role, and we have to nurture those communities. We have to support those communities, and we have to effectively allow to grow these communities in our industry. Because we want to get a more responsible and sustainable industry. And for this to happen, we have to reinforce, of course, our economic value, etc., employment, reduction of healthcare costs, etc. Yeah, but as well the social impact element that is critical here as well. No?
I also think that Vojko told us something very important before, namely that the lonely one, the singles, they are suffering the most. Yes. So one should also consider to change the fitness industry for the singles to become maybe their second home, where they feel like home, because that's where they meet other human beings. Because being single also is very closely associated with loneliness, the feeling of being loneliness. So I think that's also one way to look at it. The more we individualize health, the more we individualize where everyone has their own smartphone and can get their own account and their own life, then they will stop looking at other people. And that's where I think the fitness industry could bring people together.
Yeah, absolutely. Thank you very much, both, for a really interesting warm-up session. I hope to get the opportunity to enjoy and learn more with you both at Cologne next November. And we are closing this warm-up session focusing in the pillar of health, having the opportunity to acknowledge again our sponsors and supporters. Save the date, please, for the European Health and Fitness Forum 2021. That will be next 3rd of September. Make sure you get your place and take advantage of our early bird registration rates. Here you have the link. Click on the link, register yourself, and enjoy a further, longer and more deep discussion and session with both Vojko and Imran next November. In the name of the board of EuropeActive and all our members and supporters, thank you very much for your time today and for your interest in this warm-up session, and looking forward to meet you all virtually in Cologne in November at the European Health and Fitness Forum 2021. Thank you very much. See you soon. Cheers. Bye.
Bye-bye.
Bye.